And I do welcome the opportunity to have this debate. In fact, a number of us tabled a topical issues motion on the Waterford psychiatric unit a number of weeks ago, Minister. You weren't in a position to be here, which was unfortunate because this was not just a scandal in Waterford or the South East. It was seen as a national scandal that we have patients being treated the way they were. We all know that child and adolescent mental health is important, but it is in disarray. It is in crisis. There is over-subscription, there is underfunding, there is understaffing, and we hear from the trade unions involved, who represent the staff, who do their best on a daily, weekly and yearly basis to provide the services, that the system is under fierce pressure. I know in Clondalkin there is a campaign to save services. Our own councillor Mark Ward is involved in that. In Wexford there was a protest in recent times as well. Mental health is a big issue. And the Waterford issue, Minister, is extraordinary. Extraordinary because it's allowed to happen. What has been reported in Waterford being allowed to happen in any psychiatric unit in any part of the country. And what's terrible about this is everybody knew about it. It's not the first time the Mental Health Commission has shone a spotlight on the psychiatric unit in Waterford. They don't blame the staff. The staff are not to blame here. They're doing their best. They blame capacity. And I want to just give you a flavour of what they found, Minister, because the report makes for very depressing reading. It said that it found that residents' general health needs were not monitored, nor were they assessed in line with their specific needs. It found that 8 children had been admitted to an adult unit in the past 18 months. These children did not have access to their appropriate services. For adult residents, it said their general health needs were not monitored and assessed by their specific needs, that they did not have access to a supply of appropriate emergency personal clothing. There was only old clothing which was stored in a disorganised manner. It was unclear what was available concerning size and gender-specific clothing. No emergency underwear was available to residents. Bins were overflowing in both the male and female communal toilets. Discarded cigarette butts were found in the sink of the ladies' communal toilet. Thick cobwebs were observed on the skylight in the Brandon unit. Brown staining was observed in the assisted bathroom. And on top of that report and all that it contained, we had photographic evidence of patients lying on floors. And when the management of the unit were asked about this, they said that's a regular occurrence because it's oversubscribed. And when I spoke to the trade union on this, Minister, they said yes, the unit needs more capacity. And yes, there is a difficulty because a previous government, I think it may have been a Fianna Fáil government, took the decision to close St Sennans in Wexford, with the disastrous consequences that had, because all of the patients there are referred to Waterford with no additional capacity. But the real problem here is vision for change. It's in the community. That's what the unions are telling us. It's in the community. It's in primary care. It's in proper residential care facilities for people with psychiatric needs. So it's across the board. And, Minister, I don't know, did you visit the Waterford Centre yet, or when that visit is going to take place? But this needs to be taken very, very seriously. The fact that this has been allowed to happen time and again, year after year, when we had several reports from the Mental Health Commission who have been talking about this. And I'm sure you read the report, Minister. I'm sure you took the time, as I did, and Deputy Butler did, and Deputy Brown did, and we tabled a motion on this issue. I'm sure you sat down and you read that report. And I'm sure you must have been as horrified as I was when you look at the state of the unit itself, the massive overcrowding, almost on a daily basis, the lack of capacity, patients being sent home with no proper treatment, no plan in place for some of the patients. And the pressure is coming, I know, because what's happening is, if we don't have the investments in primary care, people are being sent to the acute psychiatric unit, maybe sometimes unnecessarily. But all of that is down to not implementing in full a vision for change. So can I say to you, Minister, and it's easy to dump it all on you, you're one minister, but you are the minister with responsibility for this area. So if you have read that report, you have to be as outraged as we were, and as the people of Waterford were and the people of the South East were. And there has to be change. We cannot come back here in 6 months' time or a year's time again and hear of the same stories. And what I want to hear from you today is, what is it that the government is going to do to make sure that we don't see this happening again in the future?